Anita, as much as it is welcome news that numbers of infections are expected to go down, there's a big question of when an approved vaccine will be taken up across the globe, right?
Kevin, the jury, or should I say research labs, are still out on the search, and I can tell you that it is definitely a scramble for that desperately needed shot that would lead to a cure.
The spread of COVID-19 has changed the world as we know it. Since it was first reported, countries across the world, including Kenya, have turned to their best scientists searching for answers in the hopes of creating a vaccine that can then return some form of normalcy to the world. The irony in all this is that in normal circumstances, vaccine development takes years, if not decades. But these are not normal times, and as a result, developing a COVID vaccine is being hastened. There are several phases a vaccine must go through during trials before being released. They range between the preclinical testing phase and the final approval stage. Russia and China are 2 out of 9 that are in phase 3 and administering the vaccine to thousands of people. To date, there are more than 165 vaccine prototypes under development. Out of these, 37 are in human clinical trial stages. So far, only 3 have been approved for limited use and none has been approved for full use. Russia, which was the first country to announce that it had begun its production of a version of a COVID-19 vaccine named Sputnik V, has begun releasing it to the general public. More than 20 countries have requested over 1 billion doses of Russia's vaccine despite safety concerns that have been raised by health experts. Kenya is one of them.
Through the Ministry of Foreign Affairs, shall engage to find out, what exactly, what vaccine has been deployed, is it working, and also if it should be necessary for us to then plug into the Russian vaccine, that will happen in the laid down protocols.
The Russian vaccine is not the only one that Kenya is interested in. The Ministry of Health says the country is working on something with Oxford University.
We are still on track as far as the Oxford vaccine is concerned, which is the one that we are collaborating through the Kemri Wellcome Trust Research Institute with Oxford University in an early phase trial of that vaccine. That one is on track. The protocol has been approved and recruitment is going to get started very soon.
However, Kenya might have to wait a little longer for the Oxford vaccine because human trials have been temporarily halted after a subject developed an unexplained illness. Oxford says it is currently trying to establish whether the patient's condition could be related to the vaccine. Kenya is also one of 92 economies that are engaging with the WHO and the COVAX Global Vaccines Facility. Countries that are part of the initiative will work with vaccine manufacturers and the WHO to ensure a timely, equitable access to all vaccines licensed and approved.
The first priority must be to vaccinate some people in all countries rather than all people in some countries. This is not just a moral imperative and a public health imperative. It's also an economic imperative. In our interconnected world, if people in low and middle income countries miss out on vaccines, the virus will continue to kill and the economic recovery globally will be delayed.
The road to getting that magical potion, so to speak, is still a long ways out, and our continued coverage on 6 months of a pandemic goes on till Sunday.